Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa, and I'm with PAR5 Physical Therapy, and I've partnered with Better Spaces to bring you an easy and educational workday session. So today's session we're going to talk about is part of the Build a Resilient Body series. We're going to go over the neck. A little bit about me. I'm a doctor of physical therapy. I've been a physical therapist for over 20 years. I opened my practice here in Randolph, New Jersey in 2019. And I specialize in orthopedics, golf fitness, and everything. And my motto is that everyone should be able to perform simple maintenance on their own body to maintain their ability to move better, feel better, and play better as we age. So without further ado, let's get started. I'm going to take away this lower third here, and then we're going to transition into PowerPoint. Let's see if it works. There it is. It's up. All right. So this class is going to be for you if you have neck pain, stiffness, or something going on. You're stuck working from home. Your office hasn't opened up, or if it has, and you're working at a workstation that's not set up correctly, we're going to talk a little bit about that. Also, if you have numbness or tingling in your arm, neck issues, the nerves that come out of the neck, they also can go into your arm, into your shoulder, and cause those numbness and tingling sensations. Or this is also for you if you don't have any neck pain, you want to keep it that way. That's awesome, right? Be proactive. Now, just an important note, I have to say this, if you've been to my other classes and webinars, I have to say this, that this is not physical therapy. This is just general advice for everybody to help with any neck pain or stiffness. If you do have something specific going on, you should go and seek medical attention or a medical consult to get your individual issue resolved. All right? So again, I say this every time because I think it's so important that everyone should understand how their body works. Their body works on this alternating pattern of stability and mobility. If that pattern is disrupted, then pain or injury is the result. So here's a little video about how that pattern starts. It's alternating stable, mobile, stable, mobile, stable, mobile as we go through the body. And we've gone through the other parts of the body before. We'll zoom in on the neck. Now, the neck is one of the most mobile parts, mobile segments of our body. It turns, it looks up, looks down, whatever. We divide it into a lower neck and an upper neck. The lower part of your neck, just above where your rib cage ends, and the lower cervical area, that's classified as our stable segment, right? So it's supposed to be stable. The next segment, and it's usually the top 3 cervical vertebrae, are classified as being our mobile segment. That needs to move and rotate as much as it can, okay? When we go through the stretches and mobility things today, make sure that you're not pushing through pain. We don't want to cause anything to get worse or make your problem worse. Just go through it gently. And when we're holding a static stretch where we're trying to elongate soft tissue, muscle, tendons, or fascia, we want to hold that for at least 30 seconds. If we're trying to mobilize a joint, make a joint move better through its available range of motion, we want to do that repeatedly for a 2-minute time mark. Okay, so this is one of the tests that I have all my clients do. This is called the general neck flexion screening. Now, if your jaw is closed, your mouth is closed, you should be able to take your chin and then put it on your chest, all right? Put it right on your sternum. There shouldn't be that much space in between. If you're like this and like, oh, I feel tight, then that's a problem, all right? We can kind of unpack why that occurs. And then the other direction is called neck extension. This is the neck extension test. You should be able to stand up nice and tall, jaw closed again, look up as high as you can, and get the plane of your face within 10 degrees of horizontal. Okay, so that's normal physiological range of motion that you should get. And then turning, rotation, right? If you're, again, mouth closed, and if you turn without moving your shoulders, you should be able to get your chin at least to mid-clavicle, mid-collarbone, right? I'm a little tight. Can't get my chin to the collarbone, but I can certainly turn about 70 degrees here. So that's about 60, 70 degrees. If you can turn to mid clavicle, but the next test would be to get your chin into your collarbone, and that's a tight spot for me. All right, I wanted to touch on a little bit about headaches. Headaches can be also caused by neck issues. It's called a cervicogenic headache. That's the bottom middle picture there, the neck. It's sort of like a headache that starts at the base of the neck and expands to the front. These are different types of headaches right here. And then trigger points. Trigger points are points that we can kind of poke and push in a muscle that causes radiating symptoms in another area. So if we look at this picture here, this slide, there's all these different muscles in the neck, the jaw, the head that can cause pain in different areas. Like if we can look at the bottom right here, this says upper trapezius muscle. That's right into this area. A trigger point or a tender spot in there can refer up into the side of the head or into the front part of the head. So that's the referral pattern. So I always tell people that pain is just a signal, an electrical signal that goes to your brain. Your brain has to interpret that signal as being sharp, dull, achy, whatever. It classifies it as a threat, but that pain signal doesn't tell us what or where is the problem. So even though you might have a pain that kind of like extends through here, like, oh, this is so tight, I got a headache, that can originate from a trigger point in the upper trapezius. All right, so a little note about perfect posture. There is no such thing as perfect posture. We can optimize our position to be in a good posture, but our bodies are not designed to be in a static position for any prolonged length of time. So my rule is that if you're going to be sitting and you're going to be working in a seated position, you should not be in that position for more than 30 minutes. Every 30 minutes, you should move, get out of that position. We'll talk about what that is later. If you're standing, if you have a standing desk and you're standing and working, you should not be in that position for more than an hour. So our time limits for any static position should be 30 minutes for sitting and 1 hour for standing. Anything longer than that, then our body tends to adapt and change into these positions that we assume. So if we're sitting, we're always looking forward and getting into our work day, and our back is rounded and our head is forward, our body will adapt to that position. So everything in the back gets long, gets stretched out, gets weak, and then everything in the front gets tight, and then we're unable to kind of regain a normal posture after that. So our body adapts to the postures and positions we put it in. So let's look at some common stretches. Some common stretches to kind of get this neck a little bit looser. But before we do that, I want to talk about muscle tone. So if we're going to stretch a muscle, we have to allow that muscle to relax. So when we have pain or stress or some type of stimulus, that causes our muscle to contract. We want to have that muscle be able to relax if we put it into a stretch. The easiest way to do this is to work on what we call the parasympathetic nervous system. It's the rest and digest nervous system versus the fight or flight nervous system. We know when we're under stress, like, oh, we're thinking fight or flight, we want to relax that part of the brain, get into this rest and digest position or state. The way to do that is to control our breathing. So if we're going to go into a stretch, we want to inhale 2 seconds and exhale 4 seconds, in and out through the nose. Inhale 2 seconds, exhale 4 seconds. So that long, slow exhale allows the muscle to relax and respond appropriately to our stretching. All right, so you probably have seen this video. I've done this in other workshops. This is a thoracic extension mobilization. It's taking a foam roller, placing it on the floor, and extending your trunk, extending your mid-back. Now, that is related to your neck. If we don't have a lot of extension through our mid-back, what happens is that we stay rounded, and then our neck and head tries to compensate to get us vertical. So we walk around like this, right? So we have to extend through the mid-back, and then that will give us a better position for our head and neck. The thing with this, we'll talk a little bit more about some points of performance. is that we want to get that movement from our mid-back, not from our lumbar spine. This is another way to do it in the chair. I'm going to demonstrate that in a second. And then chin tucks with extension. This is a way to extend or work on getting out of bad positions for your neck. And then the suboccipital release. So before I move on with our little slides here, let's talk about the things that we just saw. So we've got the foam roller. I'm going to grab this over here real quick. And if we put this on the ground, I'm going to put this down. Perfect. If I put this on the ground, I'm going to extend my spine through the thoracic area. So when I put this on the ground here, I'm going to start on my lower ribs. I don't want to put this on my lumbar spine, my lower back. So once I get this on the ribs, I'm going to create tension in the back tissue. I want the back tissue to be tight. So I'm going to pull my elbows forward to create tension. That gets my shoulder blades out of the way. And then I extend backwards. I don't want to relax the abdominals. I keep my abdominals on so my lower back doesn't extend. And I repeatedly do that. Again, this is about a 2-minute time frame through different levels. So I'm going to go as far back as I can, trying to keep my back flat, keeping my back from extending, just getting this through my mid back over the foam roller. And I'm going to roll it up. I'm going to scooch down. That takes the roller to the next segment, and I'm going to repeat. So I'm going to do that repeatedly through each segment, trying to look through an area, look through a segment, look for a segment that's a little bit tighter than others, and I'm going to spend time on that. I can't do it like this because if that creates slack in the tissue, I don't mobilize the joints underneath the muscles. All I do is just stretch the tissue. I want to mobilize the joint, so I have to create some tension. I can put my hands like this, keep my shoulder blades nice and tight, separated so my back tissue is tight and I can mobilize into the joints. Another way is on the chair. I'm gonna grab the chair, pull this over here. So whichever chair that you're using, you're gonna use the back edge to mobilize your thoracic spine. So key things is you wanna get your hips as far back into the chair as possible. Then we're gonna sink back, get my mid back on there and repeat the same thing. I took my shoulder blades, I brought them together, separated them by bringing my elbows together. And then I'm going to extend my back, my mid back over the edge of the chair. I could do that repeatedly through a segment, not hyperextending my back. So I still want to keep my abdominals on. So I'm just not arching my back. If you feel this in your lower back, you're doing it wrong. We want to get it right at the segment that is leaning against that edge of the chair. And then we're going to repeat that by kind of just sliding down and seeing if we can use that edge again in this fashion to get a little bit higher. So again, elbows forward, shoulder blades separated, tissue nice and tight in the back, and I'm extending repeatedly through that segment. Another thing that we talked about was the chin tuck. So the chin tuck is our way of a posture correction. So for example, if we're going to be sitting for a prolonged period of time, 30 minutes, we got to move, right? If we cannot stand up, we can't get out of this position. We're in a meeting, for example, you can kind of work your way through movement without standing up. Hands are going to be on your knees, and then we're going to overextend the spine and then flex to slouch. So I'm just moving my pelvis, lower back. Once I find my mid-range for that, then I work upstream here. I can keep my shoulder blades down and back and then do what we call a chin tuck. The chin tuck is basically a reversal of this position. This is your kind of like text neck position. We're just going to bring the chin straight back. Okay, so I'm not moving my shoulders. I'm just taking my chin, keeping my head level, and bringing my chin straight back. So that's stretching out that high cervical area and getting rid of this forward head position, which flattens out the curve of your neck, the curve of the spinal column in your cervical spine. So we want to try and do the chin tuck. And then this again classifies as joint mobilization. So I say, you know what, let's just do this a couple times, make sure that we're staying level. We don't want to look up. We don't want to look down. It's basically level, going straight back. And we're doing this for about 2 minutes. Okay. If we need more stretch, then we can take that into what we call a cervical chin tuck with a cervical extension. It looks like this. We're applying the force going backwards. You can use your finger to actually guide your chin backwards. Once we get to this back end range, we're going to keep the chest down, keep the ribs down, keep your spine level, and then we're going to look up. maintaining that chin tuck as far as we can. At some point, we'll have to unlock the neck. We can't continue to go back with that full chin tuck. And then at that point, we'll just unlock the chin and then bring the head all the way back, mouth closed, jaw closed. You feel that stretch. And then from this position, we're gonna bring it back down and see if we can bring that chin into that chin tuck as soon as we can, back into that chin tuck position, and then relax. So we're gonna do that again. So shoulders stay put, chin tuck straight back, and then slowly chin comes up. At some point, you have to unlock the chin, bring the chin to the ceiling, and then try and come back, chin tuck as soon as you can in that range of motion, and then relax. So that's our chin tuck. That's a self-mobilization for your neck, and that would work well if you are experiencing nerve symptoms in your arm. The other one I want to talk about is the suboccipital release. The suboccipital release is done with a lacrosse ball or some type of other implement. It's basically this. It's a rubber ball. I like using this because it's tacky. And this is to address this back ridge, which typically could be the source of where all the headaches come from. So we're going to apply pressure. And we apply that pressure by lying down on the ball. So see if I can get this on my camera. We're going to put that ball right at the base of the head. You'll find that if you slide your hand down the base of the back of your head, you'll find like a little bump. That's where we're going to put the ball, and then we're going to lie down. Hopefully I get it. There you go. I'm in the camera. And then that might be a little bit sensitive, and I'm just going to kind of rub my head side to side, rotate it up and down a little bit. It's not going to be a big move, but what I do is I find a spot that might be a little bit tender, like, ooh, that's a tight muscle right there. I'm going to sit on that, work on my breathing, that nasal breathing, 2 seconds in, 4 seconds out, to relax my central nervous system, relax the muscle. And then I'll do a little bit of shaking my head no, or going up and down to release that tissue. And that's going to be a 2-minute work for that. All right. So those are some things that I would suggest to be helpful for addressing neck issues. So we went over the suboccipital release. I think if you do have any more questions, let me show you this. There you go. I have a ebook. You can download this right now. You just go to the website, that URL that says right there, par5pt.com/neck pain treatment. Neck, and there's a slashes in between or hyphens in between. So it's just a simple book that you can kind of repeat what we talked about today, and gives you a couple more tips and tricks to try and heal your neck pain.